Why would people want to come to Darwin? Well, it's just such a fantastic place to be working and living, and the specific areas that we're involved with our research here at the Menzies School of Health Research is what's called clinical tropical medicine with a focus on infectious diseases. And in addition to that, we tie in very much with the public health colleagues here. So when you talk about the training that we have here, we have exposure for all sorts of infectious diseases that people will not see when they're living and working what we call down south. And it's always exciting, and also it's such an important area for improving the health of people in our region, particularly for Indigenous health. Historically, we've trained large numbers of people up here who've spent anywhere between 1 year and 10 or 20 years up here. At the moment with COVID, which is affecting all of us in Australia, we have the people running the COVID responses in New South Wales, the ACT, WA and Tasmania. All of them got their main training in public health right here in Darwin with our Northern Territory Centre for Disease Control, and some of them work with us in the hospital as clinicians as well. The current acting Chief Medical Officer for Australia did his PhD here with us. The person who is current president of the Australasian Society for Infectious Diseases, which is the peak body in Australia for infectious diseases training, did his PhD here and worked with us as a colleague, first of all as a registrar and then as a trainee, that is, in infectious diseases, then as one of our colleague infectious disease consultants. The past president of ACID also did his PhD here and was also a registrar and a colleague working with us. All of these people have had the opportunity to come and work here and have contributed enormously. It has been fantastic to have them come through and work with us. We still keep in touch with them. You know, people ask, well, when's the best time in training to come and work here as a nurse or as a doctor? And mostly people would say you could certainly start here as an intern. And we've had some medical students who have come here working for their electives who had never really been outside of the big cities down south, and they've enjoyed it so much they've wanted to come back to actually start their medical training here as interns, which is the first year of medical training. And some of them have stayed on. Some of them have then gone back to complete specialist training down south and then come back up here to the north. So you can come in your early years if you're into exciting work and an exciting lifestyle. Some of the most adventurous of our junior med students and colleagues have decided that they'll actually start off in Alice Springs Hospital, which is a fantastic opportunity as well. And we've over the years seen some great trainees go through Alice Springs Hospital, some of whom have ended up going back there to work as well, or to work in rural health in remote communities, or with the retrieval services, which is the flying doctors. Or some of the other people have come up after a couple of years of training in a big city hospital. They're getting a bit jaded and they've come up here as a junior resident medical officer or a junior registrar and then proceeded with their training with us. So in many different areas, internal medicine, public health, surgery, obstetrics, paediatrics, all of them have opportunities that are just not available elsewhere in the country. If people have a predilection for research and they want to get some good publications, this is the place to be. We have an enormous publication output from some of our senior researchers here, and it's world-class research, and it involves diseases which are important not just in Northern Australia but often important globally. We also have a substantial offshore program, which is through the Menzies School of Health Research, particularly in malaria and tuberculosis. So we are probably the most active of the Australian research institutes in offshore research in tuberculosis and malaria. And we've had a substantial number of people come through and do their PhDs here, then linked in with particular programs overseas. Some of the people who train here see their training as being very practical, and they then go and work for instance, a non-government organisation, MSF in particular. Heaps of MSF doctors and nurses have spent time training in Darwin. So they've then gone and done good work overseas, often in response to disasters, for instance. And we also have here, working with us, the National Critical Care Trauma Response Centre, which is the peak grouping and training organisation within Australia, based right here in Darwin, for responding to disasters. And they coordinate pretty much all the Australian government's offshore health responses to disasters that occur and tragedies overseas. So come and join us. You won't regret it. my official position is as an infectious diseases and public health and general physician, so in internal medicine, adult medicine. But one of my real passions is snake bite and also jellyfish stings, and also we get involved, of course, with all the trauma that happens with crocodile bites and stuff like that. So with my infectious diseases hat on, we can look at all the bacteria that are in the oral flora of the crocodiles that cause the nasty wound infections. But also with the snake bites, we have at least once every couple of weeks, we'll have a snake bite where the person comes into the emergency department and the snake's often brought in, alive or dead. And one of my jobs is to identify the snakes. And over the years, I've taken a great interest in learning how to key out the identifications of the particular snakes, which are venomous and which are non-venomous. If it's a venomous snake, we obviously have to keep them in and sometimes give them anti-venom. And unfortunately, we do occasionally have a fatality from snake bite. If it's a non-venomous snake, then we give them a tetanus shot and send them on their way. That's very rewarding, being able to go to someone and say, look, this snake that bit you, it's not poisonous and you can go home. Provided it's the snake that bit them, of course, because every now and then someone will bring in a snake and it's not even the snake that bit them, which is a trap for young players. If you've got an interest in natural history, what's happening in our environment, and also if you're interested in climate change, that's a whole other area. We have people here who are absolutely working tirelessly about addressing issues of climate change and health. And I know that's different from snakebite, but in fact I could talk a lot about what the climate is doing to our snake ecology and cane toads, but that's for another time. So you'll have to come here to maybe experience all of that.